Hello guys, welcome to our channel. Today we are going to discuss the all important topics. Okay, these important topics which will be including the PYTs, essential topics, and what we can expected topics. Also, we are going to have in this discussion and all 19 subjects that we are going to discuss. So those who are new to this channel, please do subscribe and like this video so that it will reach the more students. And before we start this session, I want you guys to tell one quote, that is, every sunrise is a second chance to shine. So even if you are giving the second attempt, third attempt, or any attempt for that sake, even it is your first attempt, so this is the chance for you to shine. Okay, first we have completed the MBBS in the foreign, and then we are giving the FMG examination in our homeland. So this is the chance for you to shine. This is the opportunity for you guys to shine and prove what you are have the talent and what you are got in your what is the zeal that you are burning to prove what you are going to do. Okay, so that is the one thing that you have to remember and prove yourself. So I want to take a moment and I want to introduce you to Triblar Edition 2. In this Triblar Edition 2, I have included all 90 subjects which will be comprising of the 500 topics. And in this 500 topics, you will be having the description and also images, multiple tables, and mind maps that will be important for the direct examination. And on average we can expect 80 to 50 to 80 topics from this book itself. And this book is already the edition what has proved in the previous examination, and here in the video you can see what are the sample pages that we have included. And there will be 300 pages, 500 topics, almost all are going to be the PYTs and important topics. Okay, and let's start the discussion today. So subject wise important topics are the high yield topics that you have to take note before the examination. You should not miss these important topics. So when it is comes to the anatomy, in the anatomy there will be one joints question and there will be one of the sagittal or the coronal or any section. It can be radiological also or it can be cadaver also. So should not be forgetted this transverse sagittal or the coronal sections. It can be anything, brain or the thoracic, abdomen, anything can be asked from this section. And epithelium and the cartilage. So on average general anatomy, you can have the 2 to 3 questions. Next, upper limb, there is an important criteria for the brachial plexus and all the nerve injuries, and also important triangles and the cubital fossa, anatomical slough box, carpal bones and their ossification. This is integrated with the FSM also, and axillary artery 3 branches. Then they also subtypes all will be asked. Okay, upper limb, these topics are very important. Especially I want you highlight this, the nerves and their nerve injuries are very important. Next, coming to the lower limb Rutherford test and the muscles and their nerve supply. This is one of the most important, and the femoral triangle and popliteal fossa. These are the some of the important topics from the lower limb. Next, in the coming to the thoracic, you will be having the coronary circulation, diaphragm opening, and esophagus landmarks. These are the most important topics. And mediastinum, lungs, artery, and heart anatomy is like less important, but these topics from the thoracic is very important. Next, from the abdomen, hernia is very important. It can be integrated with the surgery also, and blood supply for the foregut, midgut, hindgut in the embryology type, and also bony pelvis and the types. So these pelvis, it can be also integrated with the OBGYN and also FSM identification chapter. Next, coming to the neuroanatomy. In the neuroanatomy, we are important with the cerebrum and the broadman areas, and cranial nerves and sensory and the motor pathways, and also the disorders, the diseases that will be associated with the midbrain, pons, and medulla. Okay, this is also very important. Next, we also have to take note of the sensory and the motor pathways. Okay, this is also highly important for the examination. Next, coming to the physiology. In the physiology, first general physiology, the sarcomere muscle contraction. This is the highlighted, very important. EEG and the sleep cycle. These two are very important topics. In the cardiovascular, ECG and the JVP. There will be compulsory one question from the ECG and the JVP also. Cardiac cycle. and blood pressure regulation like baroreceptors, chemoreceptors. These are also going to be important. Next, from the respiratory system, oxygen, carbon dioxide transport, and the O2 graph, pulmonary function test, and the mechanic of the breathings. These topics also very frequently asked in the examination. Renal system, counter current mechanisms, electrolytes and the acid base imbalance disorders, and at least 2 to 3 it has actually increasing the pattern in the every examination. Last year there will be one, and again next examination 2 to 3. So acid base disorders also very important. Regulation of the GFR, nephron physiology, and even image based question is also asked, especially the diuretics and their mechanism of action and site. This question is also asked frequently. Neurophysiology, again sensory motor pathways, nerve fibers, reflexes, autonomic nervous system. These questions can be asked. In the gastro tract, GI hormones and the GI motility is very important, and remaining these topics can be asked in the examination. Next, biochemistry. In the biochemistry, metabolism. What are the metabolisms that is very important, guys? Oxidative phosphorylation, their complexes, and not just the complexes, it is also included in the inhibitors, right? Inhibitors, uncouplers. Okay, this is also asked, and all the inborn errors, whatever you read the inborn errors, that is important, because this itself sometimes 5 questions plus can be asked in the examination. Glycolysis, TCA cycle, only important points. What is the rate limiting step? What is the important enzyme? What is the irreversible or the reversible enzymes? That is a must thing that you have to know about this basic cycles, and remaining these topics are very important for you guys. Next, enzymes, enzyme kinetics and the regulation, competitive and the non-competitive, and also the graphs. These graphs can be also asked in the examination, especially the line beaker curves that can be asked in the examination. Genetics, DNA replication, transcription, translation, important enzymes. In that also enzymes is very important, and even if there is any diseases associated with this DNA replication, transcription, translation, that is also important. Genetic disorders, especially the Mendelian patterns, all the pedigree charts that you have to take note. Clinical biochemistry, liver function text can be asked, lipid profile, liver enzymes can be, heme synthesis, important enzymes can be asked, and less likely heme synthesis, but liver function test can be integrated with the medicine also. Next, some of the clinical enzymology that you have to take note: the glycogen storage disorder, lysosome storage disorder, and glycosaminoglycans and mucopolysaccharidosis, and galactose and fructose metabolism. These questions can be definitely asked, guys. Any question can be coming from these topics is sure shot in the examination, so should not miss these topics. Next, in nutrition, should I have to tell you guys that the nutrition is important? You already know that at least 5 questions plus can be asked in the examination. It can be integrated with the PSM, it can be integrated with the pediatrics, it can be integrated with the multiple subjects, right? So vitamins, mineral deficiencies, collagen and disorders, all this will be very important from the nutrition perspective. Okay, I want you guys to give nutrition very much importance. This is surely the topic will be coming in the examination. Next, pharmacology, absorption, distribution, metabolism, and the excretion. In this, there will be some of the important graphs. The graphs that you have to remember, these important graphs, and also drug receptor dose response curves. These two are very important. Next, important classifications that you have to take note: antihypertensives, anti-diabetics, anti-gout, and also anti-arrhythmic drugs, anti-lipidic drugs. So even if you know these topics now, this can be comprises the 10 questions. These are the sure short topics that I have included from the all the PYT subjects. Next, toxicology, poisonings and the antidotes, drug toxicity management, that is very important, right? And CNS drugs, CNS and the ANS drugs, central nervous system and autonomic nervous system drugs can be asked, and some of the only the key drugs and their adverse effects, that is also very important, such as amiodarone side effects, lithium side effects, digoxin, statins, valproate, phenytoin, carbamazepine, and also tetracycline, anti-cancer drugs. Okay, these questions are commonly asking in the examination, right? Anti-epileptic drugs or the lithium, amiodarone. If you see the your PYTs also, you will be familiar with this. Yes, these questions are asking in the examination. This we should not miss in the examination, right? You should not miss these topics and make the blunders in the examination. Next, pathology. Coming to the pathology, in the pathology, you already know that what are the important main topics guys: tumor markers, necrosis and the apoptosis, inflammation, tissue repair, and also adaptations, cellular adaptations, oncogenes and the proto-oncogenes, radiosensitive versus the radio resistance. These are topics that you can must read. All whatever I'm keep on keep the tick note. Please take note those topics, guys. Should not be missed. Next, in the hematology sections, you have to do the anemia and leukemia and lymphomas. Lymphomas also asked, especially the translocations, right? Translocations and what you can see, especially anemias and the leukemias, peripheral blood smear findings, okay, peculiar findings that you have to take note, and what are the tests that you are going to do, and what are the tumor markers that will be positive for this patient, right? These are the important points that you are going to see in the hematology section. And coming to the genetics, just now I discussed the Mendelian patterns, all the pedigree charts and chromosomal disorders plus their features. Okay, easy to take note of the features. And what are the most important? Down syndrome, Turner syndrome. These are the commonly frequently asked in the examination. Next, immunity, hypersensitivity reactions, immunodeficiency disorders. These two questions is also commonly asked. Amyloidosis, you should not be missed. Recently in the INICT is also asked, NEET PG is also asked. Amyloidosis, whatever the smears and whatever the microscope and whatever the points, that is very important for the amyloidosis. And systemic pathology, mostly you look at the heart and lungs. Okay, in the lungs also cancers, and after the cancers, pneumoconiosis, and in the heart, MI, and rheumatic heart disease, and valvular lesions. That is the most frequently asked. Next, coming to the microbiology. In the microbiology, the classifications that you have to take note, bacteriology. And coming to the infections, they will be asking of the Neisseria species and the Treponema species, Streptopyogenes, and also the bacterial cultivation and the media. This question is also asked. Genital ulcers, urethritis, sexual disorders, sterilization, disinfectant techniques, and their organism, specific organism. This question is also asked. These are the very important. Staph aureus, Pseudomonas. These are the very frequently asked topics in the examination, guys. And virology. In the virology, HIV. HIV, I will give the 100% questions. In the INICT itself, they asked us the 5 plus questions. So HIV, the complications and the infections, everything is important about the HIV. And the classification and common viruses that you are going to frequently see. And viruses, their vaccinations also. Vaccination, everything, the prophylaxis, and contact and transmission. These are the important about the virology. Next, fungal infections and the parasitic infections, that most commonly I want you guys to focus on the these topics. Okay, these topics and these three, and also echinococcus and entamoeba. Okay, these topics are very surely and commonly asked. Entamoeba, giardiasis, trichomonas, echinococcus, candida, aspergillus, cryptococcus, mucormycosis, chromoblastomycosis, porotrichosis, pneumocystis jirovecii, dermatophytes. These questions are asked. You can see jirovecii is asked in the 2024-2025 also. Dermatophytes asked in the 2024-2023. Chromoblastomycosis asked in the last year examination. So these questions are frequently asked, whether it's FMG or NEET PG or the NSCT also. Next, immunology again, hypersensitivity reactions and the immunodeficiency disorders. Next, coming to the forensics. In the forensics, again we discussed antidotes, poisons management, that has to be important. And medical negligence, what are the medical duties, that is very important. Okay. Next, autopsy procedure and the types, especially the blood and the semen analysis, types of the text like Tickman test, Takayama test, and the semen Florence test, Barberio test. These tests are very important. Identification. In the identification, you have to don't forget the skull and the pelvis, dental, and also fingerprints, right? These are the very important. And types of injuries, ballistics, and even burns. These questions are commonly asked. Asphyxia, types of the asphyxia. Please take note of the hanging and also different types of the torture methods and also homicidal. These are important in the asphyxia. Next, sexual offenses like sexual paraphilias, very important. Sexual psychiatry is also very important for the examination. And one topic that is not mentioned here, that is here, death characteristic, post-mortem changes. This is also very important for the examination. Next, coming to the surgery. Major subjects, please remember guys, 20 plus questions. Okay, these are the very score boosting subjects for your examination. Should not be missed. Sutures and the knots, this has been asking frequently. Instruments and the wound healing, hernias, thyroid disease, these are the important. Breast surgery. Okay, should not be missed with these topics. Coming to the trauma, primary trauma and the secondary trauma survey, that is very important. GCS score, fast, burns, head and abdominal thoracic trauma. In the head, you should not forget the EDH and the STH, right? Abdominal also, blunt trauma versus the penetrating trauma. What is the criteria that you have to follow? In the thoracic, you all know that pneumothorax, or the patient is having the failed chest and cardiac tamponade, right? These are the very emergencies, frequently asked questions. Next, in the pediatric surgery basics, adult surgery basics, especially tetralogy of Fallot, pyloric stenosis, duodenal atresia, Hirschsprung's disease, and thyroglossal cyst. This question is asked. And adult appendicitis, pancreatitis, acute and chronic versus the pancreatitis, and bariatric surgery, commonly asked. GERD, achalasia, all these questions, and Jenkins diverticulum. This questions is also asked in the examination. Vascular surgery, please take note about the acute chronic arterial. In this you will be having the different classifications, Boyd's classification, CEAP classifications you will be having, and also ankle brachial index. This questions is asked. Deep vein thrombus is also asked in this vascular surgery. And oncology, please take note, breast, prostate, esophagus, colon. Okay, this commonly this will be asked in the examination. And also thyroid also take note. Okay, very much important, this oncology surgeries. And the urology, in the urology, urethral trauma should not be missed. And renal stones can be asked. And undescended testes, torsion, hydrocele, these are the very frequently asked in the urology section. And other some important topics like Whipple surgery, pancreatitis and liver abscess, keloid and the marcha hypertrophic scars, gallstones, and Fournier's gangrene, common ulcers, bed sores and the types of the ulcers, skin grafts. Skin grafts are very important. Next, coming to the PSM. In the PSM also, we can expect 20 plus questions. And what are the important types that you have to take note? Study designs, okay, case control, cohort, randomized control trials, cross-sectional trials. These are very important. Next, calculations like odds ratio, relative risk, attributable risk. These are the very important. Screening of the diseases, sensitivity, specificity, positive predictive, negative predictive values. Okay, and also biostatistics, mean, median, mode types, and p-values, tests of the significance. These are very important topics. Vaccination, you all know that I should not tell. These are the important topics. The vaccination, everything is important. Okay, all the vaccinations and their important topics will be should not be missed. Mission Indradhanush 2 and HIV NACO guidelines, polio prophylaxis, surveillance, important vaccines, the types, and the what we are going to see the vaccine while monitoring everything, every part of the vaccination and the immunization is important. And coming to the infectious disease, please take note of the measles, rubella, rickettsious diseases. And also you have to take note the vector borns like malaria, Japanese encephalitis, and tuberculosis, very important. Leprosy is very important. Here HIV is very important. All these circled topics are each and everything is very important, guys. Nutrition, again 5 plus questions. Okay, this is the integrated topics from the nutrition section. Next, mother and child care. This topic is also very important, especially the schemes. Here you can see Janani Suraksha Yojana and Rashtriya Bal and Suman and PM Suraksha Yojana. These are all very important schemes. And ICDS scores, growth charts, and some of the calculations and the formulas like IMR, MMR, and also the birth rates. This is very important topics. In the environmental health, please take note about the water quality indications, waste management, biomedical guidelines. You all know that this is very important. Vector control, okay, especially the larva and also the mite. These topics also frequently asked in the examination. Demography. The demography cycle is important. Total fertility rate, net reproductive rate, indications. This is commonly asked. And national health programs that you should not mix. Laksha, Amrit Scheme, Ayushman Bharat, and also PHC, CHC subcenter and their healthcare infrastructure in the whole India. What is the population, what is the staff, and what is their job, particular job that they are going to do. And pneumoconiosis, very important topics. Okay. Next, social medicine, especially the disaster cycle is very important, guys. And in the public health, again, this HIV, malaria, and contraception, nutrition, TB, leprosy, very, very important topics because these are endemic in India. So, whichever is endemic in India, that will be asked by the examiner. Next, internal medicine. In the internal medicine, is mostly like an integration only. He will be bringing the physiology, he will be bringing the pharmacology. Okay, it's more like an integration of the all the subjects. Valvular heart diseases, especially the stenosis, regurgitations that you have to take note. Ischemic heart diseases, MI, and also ECG changes. Right, rheumatic fever, endocarditis, and criteria, especially here the Duke criteria and here Jones criteria. Right, cardiomyopathies, heart failure, arrhythmias, hypertension. All topics can be frequently asked and integrated. In the respiratory, asthma and COPD that you have to take note, cystic fibrosis for the pediatrics, pneumonia and symptoms, and lung cancers that you have to take note. In the pleural effusion, at least you have to take note of the lights criteria. And in the endocrine, diabetes mellitus and management, thyroid disorders, adrenal disorders. Easily, I am going to show that 3 to 4 questions can be asked from this particular endocrine section only. And these only, thyroid, adrenal, diabetes. This is very important. And in the renal, only take note of the nephrotic syndromes, CKD patients, and Wilson's disease, hepatic serology. These are the frequently asked topics. Hepatic and the renal is very rarely asked, guys. Only take note of these topics. RTA you can be seen. In the neurology, stroke criteria and the management, Guillain-Barré syndrome, myasthenia gravis, epilepsy and drugs, Parkinson's, Alzheimer's, meningitis, and the CSF analysis. These topics can be asked. And in the rheumatology, rheumatoid arthritis, systemic lupus, ankylosing, and osteoarthritis, gout, especially this will be asked. Antibodies and the treatment. Okay, and in the osteoporosis is very important in the ortho perspective. Next, in the gastroenterology, ulcerative colitis and the Crohn's, it can be asked by the X-ray or it can be asked by the features of the diseases. HIV opportunities infection, this is actually star mark. Next, coming to the obstetrics and gynecology. In the obstetrics and gynecology, antenatal care, antenatal checkups and the screening, and abortion and types of the management, especially MTP, right? Placental types, ectopic pregnancy, antepartum hemorrhage, postpartum hemorrhage, active management of the third stage of the labor. What are the important 4 stages? Pregnancy induced hypertension. In this also, when you are going to do the cesarean section, when you are going to do the delivery of the baby. And maternal hematological cardiovascular. Sometimes recently they started asking about the respiratory changes also. And also in the gynecology, menstrual cycles, amenorrhea types, especially primary and secondary types. In the primary also, there will be asking multiple with uterus, without uterus, with breast development, without breast development, that can be asked. Okay, next in the cervix, you have to take note about the pap smear, FIGO staging, and types of the HPV and their vaccines, important of the cervix carcinogens. And ovary, histopathological findings and the tumor markers. That's it. You don't have to know about the staging and everything. In the endometrium, just take note about the staging and their management. Infertility, MTP, ectopic, molar infertility. This is very important topic. Okay, this is very, very important. Yeah, again star mark. Sorry guys. Yeah, this is again star marks. Okay. This is very important. Vaginal infections. Instruments, basic instruments that you have to take note, not much. Coming to the pediatrics, neonatal resuscitation, very important. Respiratory distress syndrome, birth defects. Growth and development, malnutrition like kwashiorkor, marasmus, and also developmental delay, developmental milestones. IMNC guidelines, right? Diarrhea, dehydration, pneumonia, meningitis, CSF analysis. Okay, these are very important. Congenital heart diseases, which will be included with the radiology science. Next, coming to the celiac disease, cystic fibrosis, seizures and their drugs. Kawasaki disease also has been asking frequently. Genetic disorders, as I said, Turner syndrome, Down syndrome is very important. Neural tube defects are highly important. Next, coming to the ophthalmology, cataract and their types, glaucoma and their drugs, trichoma and conjunctivitis. This can be 5 questions or even 3 questions must that should be coming in the examination. Next, either or either it is the vein occlusion or the artery occlusion, one will be asked in the examination. Diabetic retinopathy and their management also. Relative errors, mostly they will be asking about the prescription. Mostly they will be asking about the prescription for this myopia, hypermetropia, astigmatism. Okay, blunt trauma can be asked, corneal ulcers, squint. These questions are asked. Next, coming to the ENT. In the ENT, hearing audiology and the tympanometry and hearing aids, what we are going to use, different types of the condition, otitis media, complications such as the unsafe or the safe. Okay, next, cochlear implants, acoustic neuroma, otosclerosis, right? Inner ear anatomy and the embryology. These questions can be also asked. Coming to the nose, mostly epistaxis, rhinoscleroma, sporidiosis, CSF rhinorrhea, atrophic rhinitis. Coming to the pharyngitis, you are going to have the facial palsy, vocal cord palsy, laryngomalacia, and muscles and the cartilages. Okay, this can be asked. Pharyngeal abscess rarely asked, but these topics are most frequently asked. Salivary gland tumors that can be asked. Right, these are the very another key topics, guys. Okay, must and should that you should not be missing. Right. Next, coming to the orthopedics. In the orthopedics that you have to take note, pot spine, osteomyelitis, bone tumors, avascular necrosis. Okay, and some of the spleens and the tractions. These are very important. Next, polytrauma management. Different types of the complications like fat embolism. These are the deep important thrombosis, and the diseases that you syndrome, have to right? Remember. These are very common questions. Those who are new to this channel, please do subscribe. Next, coming to the nerve injuries, highly important. Never miss the nerve injuries. Okay, upper limb and the lower limb nerve injuries, joint disorders and rheumatoid arthritis. Coming to the next part that you have to take note, sports injuries like especially meniscal tears. And in this you have to take note about the test. What is the Drawman test? What is the Homan test? What is the different types of the test? Anterior drawer, posterior drawer, all these tests that you have to take note. And hip injuries, foot injuries, this is also frequently asked in the pediatric orthopedics. Next, coming to the dermatology, acne, eczema, psoriasis, and also the tuberculosis, leprosy, and Ribbles syndrome. Whatever I am circling, those topics are very important. And fungal infections, their management, sexually transmitted diseases, this is highlighted. Okay, this is very much highlighted. Sexually transmitted diseases, pemphigus bullous disorders also important. And coming to the another important, hair and nail disorders. Okay, this is also very important. Acanthosis nigricans and nail disorders. Okay, these are the very important topics, guys. And in the viral infections, herpes simplex, warts, these are the commonly asked. Next, in the psychiatry. In the psychiatry, mostly I will tell that you have to take note about the drugs management, complete antidepressants, lithium therapy. Okay, these drugs and their treatment is very important. Okay, so this treatment that you have to take note, most important. All the treatment part is very important. and also the phobias and obsessive compulsive disorder, autism, ADHD. The drug is asked in the examination, and sleep cycle, right? Narcolepsy is asked commonly. Substance disorder, this is very important. Okay, another star marker. Okay, another star marker, alcohol disorder, withdrawal symptoms mainly, and in the cocaine you have to take note about the withdrawal symptoms also. And some of the race syndrome is asked recently in the INICT examination, and mood stabilizers is asked. Suicidal ideation is also commonly management, and along with that you also have to take note about the nicotine. Okay, nicotine therapy, that is important. And in the anesthesia, you all know that general anesthesia, local anesthesia, regional anesthesia, all these the drugs and side effects and indications or uses, you say, these are very very important. Next, coming to the ASA grading, this is very important, right? Next, optimization of the drugs, pre-operative medications, what you should be given for this patients before the surgery. Malampati grading, airway equipment, there is differently, but airway techniques is asked. Okay, airway techniques is asked. Next, in the intraoperative basic life support, this question can be asked. Capnography, and also in the neuromuscular train of 4 ratio, how we are going to check. Okay, and in the temperature monitoring also, how we are going to temperature monitoring, with the what device we are going to place. Next, coming to the spinal anesthesia, what you have to take note of the spinal anesthesia technique, what are the layers that you are going to cover. Okay, the epidural also same, what is the layers that you are going to see, this technique of the epidural, spinal, and also what are the needles that we are going to use. Okay, last year needle is asked in the examination, what are the needles that we are going to use. And complete daycare anesthesia, what are the drugs, what is the protocols, what is the side effects. Okay, and malignant hyperthermia, INSCT, NEET PG, FMG, all three exams is asked by the malignant hyperthermia, and the management also asked. Next, coming to the radiology. In the radiology, at least take note about the silhouette sign. Okay, and also normal findings of the lung fields, diaphragm, mediastinum, and also number of ribs. And ribs identification is very important. Lung infections, consolidation, cavitations, associated organisms. Okay, these are very important. And next, coming to the brain, in the brain that you have to take note about the acute trauma, subdural, epidural, right? This is first image based question in the examination that ever asked in FMG. Head trauma like hemorrhage, contusions, fractures, that you have to know. CT protocol for the stroke. And also infections that you should not be forgetted. In the head also you have to take note about the neuroimaging for the infections. In the abdominal, contrast studies. Okay, contrast studies that you have to take note. Ultrasound basics, how the ultrasound is used, and obstetrics, Doppler, this some of the important, there will be specific things that you have to take note. In the PET scan you have to take note about their radioisotopes like FDG, right? We use the FDG for the PET scan, and other like technetium, their half-life, radiation exposure, and that you have to take note. In the renal studies, that will be commonly associated with the conditions only, you can cover in the multiple systems. And contrast media, what are the contraindications, what is the indications for the contrast media, what we are using in the CT, MRI, ultrasound, that you have to take note. And in the trauma, fasting, that fast criteria, and X-ray, CT protocols, when to do the CECT, when not to do, that should be take note. Radiotherapy, radionuclide imaging, these are the very important topics for the radiology. Next, remember guys, discipline is the choosing between the what you want now and what you want the most. So the most that you want is the FMG examination. What you want the now is the rest. Okay, if you give up this rest now, you are going to clear this examination. So this goal is bigger than this goal, so chase after this tree and you are going to chase this. Next, so I have curated some more important topics guys. These topics are very highly important, because I have seen in the January 2024 examination almost 30 topics were came, 2024 June 50 topics. This is the one I have cleared my examination. And the 2025 January 50 questions plus June again 50 plus question. Last Jan 50 questions. Okay, this has been continuously has been seen. Okay, should not be missing. I have created almost 100 topics. Okay, neonatal resuscitation, basic life support, airway management from the anesthesia, trauma, complete trauma. And in the trauma, you have to mostly head, stomach, abdomen, and also lung fields. Important. Nutrition, highly important. Vitamin deficiencies, amino acid disorders, genetic disorders, dermatomes has been asked, nerves and their injury, malaria drugs and malaria protocols, IMNC for the pneumonia and the diarrhea, audiology and tympanometry, MTP, hepatitis serology, chest trauma, STD kits, STD diseases, psoriasis plus treatment and psoriasis plus types, milestones, all the fine, gross, language, all the social milestones, lysosome storage disorder, glycogen storage disorder, mucopolysaccharides, cataracts and types, right? Radiosensitive versus the radio resistant table, epilepsy and their drug of the choices, gout and drug of the choices, diabetic drugs, okay, all the oral hypoglycemic drugs, TB, HIV, anti-glaucoma drugs and their side effects, ECGs and treatment protocol, vaccines, bone tumors, schizophrenia and drugs, depression and drugs, toxicology, antidotes, substance abuse like withdrawal or intoxication, food adulteration in the PSM, demography and their formulas, neural tube defects, pharyngeal arches and derivatives, and leprosy, organic mental disorders such as dementia has been asked, and the patient who are suffering from the dementia, delirium, Alzheimer's, Parkinson's. Okay, Alzheimer's and the Parkinson's. Thyroid. In the thyroid, it can be hypo or it can be hyper, and even cancers. Breast cancer and staging, or drugs also you can take out. Urethral trauma, parathyroid, lymphomas, leukemias. Especially in the lymphomas, leukemias, you can add multiple sclerosis and also translocations. Okay, sorry, multiple sclerosis. I'm sorry, this is not the multiple sclerosis, guys. This is multiple myeloma. Okay, multiple myeloma. That topic is very important. Hematology. In this, peripheral blood smears, that is important. Jenkers, achalasia, ulcers, GERD, peptic ulcers, that is important. Lung tumors and histopathology findings. Pneumoconiosis, glomerulonephritis and microscopy findings. Amyloidosis and their types. Squint, extraocular muscle and cranial nerves included, and their paralysis. Vitamin A deficiency, anemia and anemia Mukt Bharat scheme and anemia types, right? All these are important. Larynx anatomy, right? Cartilages and muscles, these are very important in the larynx. And nerve supply, nerve injury. Nose bleeding, CSF rhinorrhea. Paranasal excerasis, different types. Palsy, facial palsy, rickettsial diseases, biosafety. Okay, the waste management in the hospital. Disinfection and the filtration of the water. Types of oncogenes, tumor markers, sexual perversions is nothing but the paraphilias. Along with that, you also have to take note about the semen test and also blood test. Identification, again, the skull, pelvis, and also fingerprints and dental. Head trauma, especially EDH versus the SDH. Myocardial infarction, the markers and ECG and findings, right? Diuretics and the mechanism of action, collagen and the diseases, LFTs, bone metabolic disorders like osteoarthritis, Next, TB spine and their findings, JVP, hypothalamus areas, sleep cycle and patterns, O2-HP dissociation curve, congenital defects. It can be heart related or it can be respiratory related. Vertebral levels, palpable pulses, image-based question, anatomical triangles like cubital fossa, anatomical fossa, and popliteal fossa, femoral triangle, Hasselbeck's triangle, and also Calot's triangle. These are number of triangles that will be present in the posterior anterior neck triangles also. Hernia and the therapy, varicose veins and the classifications, and valvular heart diseases, infective endocarditis, the Duke's criteria, contraception, especially the emergency contraception, acid-base disorders, and glut types of the gluts and their openings, GIT hormones, mycology, and chemo drugs and the side effects, very, very important. Parkinson's mechanism and the drugs, migraine and therapy, asphyxia and types, epidemiology studies, and their formulas, calculation formulas are very, very important. Ear nerve supply, laryngeal disorders. And some other things that you have to remember is the intubation, hypersensitivity reactions, pemphigus, Alzheimer's, Parkinson's, and also postpartum hemorrhage. And also take note about the placenta types, different types of the placenta types that you have to take note. And consistency is more important than the perfection. Again and again, I am emphasizing that consistency is very important. These are the some of the and most important topics. Even if you cover these important topics from your revision notes, you can easily clear the 150 plus. Okay, definitely. I'm going to assure you guys. So please do subscribe and share with your friends, and please do join the Telegram group and also subscribe to our channel. Like and share with your friends also. So happy preparation, guys. See you again in the next video.